Hello everybody, this is Dr. Precious once again here to answer yet another question. Today we are going to discuss fibroid. We're going to talk about all things fibroid. Before I dive into it, how are we doing? I trust we are all doing fantastic. Today is a sad one. I'm sad because I received an anonymous question in my inbox, and there was a lady that described her whole journey with fibroid and pregnancy. So I'm going to talk about it, but I'm not going to read the question because she wishes to remain anonymous. And let me use that opportunity to say, if you have a question that you don't want to write out in the comment section, or is a personal thing to you, you can always inbox me the question, but please write on the top of it question, so I will be sure to look at it, because I have many messages coming on my inbox, and sometimes if I'm not looking out for it, I may not look at it because I can't, it's impossible to go through every message. So yes, please do that. Now let's dive into it. What is fibroid? Fibroid is something, let me give a little background, it's something that affects many women, especially Black women or African American women. Fibroid is in some research says up to 80% of women will develop fibroid in their childbearing years before they reach menopause. So fibroid is something that is very prevalent out there. It affects many people, many women, especially Black women. So what is fibroid? Fibroid is a growth, a tumor that grows in the uterus. Where is the uterus? Uterus is where the baby lives for 9 months. It's where the baby is conceived and stays for 9 months till the baby is born. Now, this tumor is usually benign. Benign meaning that they don't invade other tissues. They grow, but somehow they're confined in one area. That is the difference between a benign tumor and a cancerous tumor. So this tumor grows in the inner wall of the uterus, is being fed by hormones, namely estrogen and progesterone. It depends on that to grow. It can range, the size can range from the size of a marble to a baseball, and in some research even up to the size of a baby itself. So this tumor can be very problematic most of the time. It's not something that will be ignored. So you as a woman, what is it that you look out for? You look out for pain in the pelvic area. You look out for heavy menstrual flow. When you have to change your pad, maybe every 2 hours, is not normal. You also look out for extended period for maybe more than 8 days. That is not normal. Pregnancy complications, infertility. It has to do with a lot of things. It causes a lot of issues. So when this fibroid is discovered, your doctor will usually speak with you, and so the good news is that there are treatment options. But these treatment options is dependent on what stage in life the woman is and what they're going through and what they want to do with their future. For example, if it's somebody that is planning to have children, the treatment option will differ because they want to be able to preserve the womb. If it's somebody that is already near menopause, they might try to manage it, because after menopause, it usually is expected to shrink. So aggressive treatment may not be recommended at that time. So there are many different treatments that can be used. Okay, There is treatment that can be used to remove the growth itself and still leave the uterus, though that may lead to complications in the future when the person becomes pregnant. Okay? There's treatment option where they can use hormone to stop the bleeding and things like that. There are treatment option called like embolization, where they actually starve the tumor to death by blocking blood flow. There are other ones where different things are done. They can freeze it, they can use current, electrical current. There are treatment options where they can actually use ultrasound. So just know that there are so many different types of treatment. Some of them to remove, to kill the tumor, some of them to actually remove the tumor, and the ultimate is to take out the womb completely. And that is actually the only sure way to make sure that it will not return or is gone completely, is to remove the entire womb. And that surgery is called hysterectomy. So that is the major cause of hysterectomy, actually, is fibroid. So what causes this fibroid? Why do someone get it? Actually, the exact cause, I'm not sure anybody knows. I'm not sure anybody knows what the exact cause is, but there's something called the risk factors. That means things that combine and may cause that to happen. Number one, age. Like I said earlier, women in their childbearing years, after teenage years, up until before menopause. Number two, genetics. Everything we do, everything that happens have some kind of link. Most things have some kind of link to genetics. If your mother had it, maybe the child may likely to have it as well. Another thing is obesity. Obesity seems to is also linked to a lot of bad things, which is why we all try to stay healthy and try not to be overweight. I may cover that pretty soon because I've been getting that question too. Another one is vitamin D. Research says that vitamin D is actually good for you, and that women that are not having enough vitamin D in their system is less likely to get it than those that don't, according to research. But please, anything you want to do, make sure you consult your doctor first. Okay, so these are the things that are called risk factors that may increase one's chance of getting fibroid. So, in conclusion, we talked at length about fibroid, what it is, who gets it, Black women more than their white counterparts, when, during their childbearing years. What does it do? It causes a lot of complication issues, pain, heavy bleeding, excessive bleeding, pregnancy complications. These are things that the women that are affected by that deal with. What is my advice for women? Be your own advocate. See your gynecologist. Who is a gynecologist? A gynecologist is the doctor that deals with that area of a woman's body, the reproductive system, everything down there, including pregnancy, birthing a child, and all that. So see your gynecologist. I believe is recommended once a year. And they check these things. Sometimes they check it and they catch it early. And anything that is caught early is easier to deal with or manage. So see your gynecologist, especially if you're planning to have children. So they check these things on the regular, and if they suspect anything, they will go into further testing and be able to find out specifics and begin treatment immediately. Now, to all the women out there that are dealing with this, I'm sending love and light. I'm sending hugs. I'm sending prayers. You will be okay, sis. Stay strong. I know it's something that will not be easy emotionally. I want to thank everybody for listening once again. Do not forget to share, like, subscribe, comment, contribute. If I missed anything, you can let us know, because I'm here to learn as well. This is a community where we learn from one another. Stay tuned, because we have a lot of things coming up. We have diabetes coming up. We have breast cancer coming up, because this is actually Breast Cancer Awareness Month. And I may be able to have a doctor that actually perform breast surgery on the panel to actually talk about it. We're still working out the logistics. I'm not sure yet. But we're going to be talking about that. Then we're talking about, I know there's a lot of questions about holding the teeth. We will get to that as well. So we still have a whole bunch of questions to answer. So stay tuned. We'll be doing that as soon as we can. Do have a wonderful, wonderful day, and I will see you next time. Thank you for watching. Love you all.